Benefits of Breastfeeding by Jody Kuhn, American University, February 2019. Breastfeeding is widely accepted as a healthier method for meeting an infant's nutritional needs. Many reputable organizations, including the World Health Organization, the American Academy of Pediatrics, and the American Dietetic Association, recommend breastfeeding as the ideal form of nutrition for the first year of an infant's life. Organizations such as these provide guidance that infants should be breastfeeding exclusively for the first 6 months and then slowly transitioned over to solids while still receiving breast milk until the age of 1. Despite these undisputed benefits, breastfeeding rates are still below national and global targets. Benefits of breastfeeding for the mother. Extensive studies have been conducted on the health benefits of breastfeeding, and there appears to be little debate over the benefits of the mother. Peer-reviewed articles consistently cite decreased incidence of breast cancer, diabetes, high blood pressure, and increased weight loss, although the weight loss results are somewhat mixed. One case control study was completed in 2010 analyzing 128 cases of breast cancer patients in India. Random sample was used to select the same number of control cases. The study concluded that breastfeeding had a significant role in the reduction of breast cancer. A meta-analysis of 47 studies across 30 countries also indicated a statistically significant decrease in risk of breast cancer as the duration of breastfeeding increases. While studies seem to agree that breastfeeding reduces the risk of breast cancer, results are less notable regarding the positive impact on maternal weight loss. One study examined data from U.S. women between 2005 and 2007 and evaluated weight loss results among those who breastfed exclusively and non-exclusively. Compared to women who did not breastfeed or only breastfed intermittently, women who breastfed exclusively for at least 3 months resulted in a 3.2 pound greater weight loss. These results were supported by another study conducted by Dewey and Associates, which compared weight loss during the first year after delivery for mothers who breastfed for less than 3 months and those who continued for more than a year. They also found that women in the long-term breastfeeding group lost on average 4.4 pounds. Benefits for the baby. Extensive studies have also been conducted on the benefits of breastfeeding for infants, and again, results are extensively supportive. In one review of the 28 studies investigating the correlation between breastfeeding and childhood obesity, a significantly lower risk for subsequent obesity among children who were breastfed was found. There are at least 2 schools of thought for why breastfeeding protects against obesity: the adaptation to flavor profiles and acceptance of vegetables versus the child's ability to regulate food intake. Breast milk represents the flavors of the foods the mother is consuming, and those flavors are passed on to the infant, which can influence the child's acceptance to a variety of foods as he transitions to solids. Manella and a research team tested the theory that an infant's exposure to a flavor in breast milk will positively influence his acceptance of the same food in solid form. While the study found that the exposure did not impact the initial acceptance of solid foods, it did increase the infant's intake more rapidly, and these infants consumed more vegetables after repeated exposures. A second hypothesis is that breastfeeding positively influences BMI and prevents obesity by teaching infants self-regulation in response to hunger signals. Mothers who breastfed have no visible way to measure their infant's total consumption. Instead of the sight of an empty bottle, mothers must rely on their infant's cues to gauge the level of fullness and trust when a baby stops nursing, they have received the proper amount of nutrition. Bottle-feeding mothers, on the other hand, may be influenced by the visual cues and a mother's decision about what the proper amount that must be consumed. As a result, bottle-feeding mothers can more likely influence an infant's initial response to being full by encouraging the infants to consume more than needed. Several researchers have also examined the relationship between breastfeeding and cognitive development. One research reported lower IQ scores in children consuming formula as compared to those who were breastfed. This study raised concerns about the socioeconomic status of the study participants, in which led to an examination of the participants in the studies previously referenced in this paper, and raises the question of race and socioeconomic bias in the results. If research overwhelmingly demonstrates health benefits for both mothers and their infants, why are breastfeeding trends not higher? Upon further examination, it was found that several of the studies cited in my paper were conducted with middle-class Caucasian women. Other studies did not specify the race of their subjects, but also did not account for their impact in their results. This led to the question of differences across race and breastfeeding results. One study reports that African American women in the United States use formula at disproportionate rates, and this leads to health disparities among the population. The CDC confirms that while differences in breastfeeding rates between African American and white infants vary by state, rates are consistently lower among African Americans in most states and significantly lower in 23 states. Among infants born from the years of 2010 and 2013, 17.2% more white mothers breastfed their infants compared to African American mothers. Another study that sought to examine the rates of breastfeeding by race found that, relative to white mothers, Mexican American mothers were 30% more likely to breastfeed for at least 6 months, and African American women were half as likely to breastfeed for at least 6 months. More than simply promoting the benefits of breastfeeding for both infants and mothers, more needs to be done to address the barriers mothers from various races and economic statuses may face. These barriers can include the lack of policies or ineffective policies that support breastfeeding, allowances for pumping in the work environment, more resources for providing breastfeeding equipment, and better access to professional support. A deeper understanding of these obstacles and how they impact a mother's decision could help improve the efficacy of breastfeeding promotion campaigns and ultimately infant and mother health outcomes.